You would have to request the permission to share the screen.
Okay, I sent the request.
Perfect. Okay, in the meantime, hey guys, how are you doing? As you can see, my phone is there, so we are going live on Zoom. I have Dr. Nikhil with me, and hope you guys can hear me, hear both of us. Dr. Nikhil, can you say something so that we know that you're audible?
Hi, good evening. Can you guys hear me?
Okay, can you guys hear him, please? Tell me. Okay, I think they can hear us.
Okay.
Okay, yes, they can hear us.
So
okay.
You'll start?
Sure. Thank you for joining the discussion, first of all. Amazing. I've been asking a lot of people for the past few days to have a live discussion regarding certain things. And as you know that I've been educating people for the last 10 years. And my views were very much aligned with probably your views. But under the recent evidence, some of those views have started changing. And when I started looking deeper, I figured that, okay, there are some things which are problematic and needs to be questioned. And so that's basically it. So,
right.
Yeah.
Okay, so everybody knows you, but I don't think many will know me. So I'm Nikhil Aggarwal. I'm a general physician.
Yeah.
I'm also a two-time blood cancer survivor since 13 years. And recently I have been selected as a cancer patient advocate with NCG, which is headed by Tata Memorial Hospital in Mumbai. And NCG is basically a group of all major cancer hospitals and the NGOs all over India. So I recently did my training for that. So as JC introduced the topic we will be discussing today. First of all, I want to tell you that I am not here to prove anything like I am right or he is right or anybody is wrong. My purpose here is to present facts as they are available in the public domain and some information which I know as a cancer patient advocate as well as a survivor through lots of cancer groups what I see in routine. And I don't have any conflict of interest. I don't prescribe HPV vaccines. I'm not a gynecologist or oncologist. But because I am associated with cancer at my heart, so I wanted to talk about this topic.
Sure.
And of course, I am a doctor, so I know that this is important.
Sure.
And before that, I want to say just a small thing. I mean, it's everything is different. Everybody has their different views, but a lot of people are consuming alcohol, tobacco, they're doing smoking. JC has also been posting a lot about that. Like people in Western countries are reducing alcohol, but in India, people are increasing alcohol. So those are some things which are 100% bad for your health. There is no benefit and the harm has been very well established and nobody can doubt on that they are bad things. But still people continue to take those things without questioning, without asking science whether it is good or bad or any sort of that thing. But when it comes to medicines or vaccines, any vaccine, and particularly nowadays it is about HPV, which has very robust data, which we will share later on. So in these things, people question and they question medical science, doctors and anybody who is talking about those things, which is very strange, but it's okay. It's a free world. Everybody can have their opinion and their decisions. And here I will try to tell you why HPV vaccine is important and why cervical cancer cases are in reality very high and why you should get the vaccine and a few other things I will tell about cervical cancer. And then it will be your decision because as I said about things like alcohol and all, you make your decision. So for this also, you will have to make your decision. If you are convinced that this is something good for you or most likely for your kids, get for it. If you still feel that this is only a propaganda or some conspiracy to infect you or to make you infertile or any sort of those things, then it's your choice. whatever you decide. So another thing is my presentation skills, tech skills are not so good, and I have some breathing issues also, so I might not be able to speak very well. So please don't judge the session based on those things. Just judge based on whatever I present. So just briefly about myself, I have been a cancer patient. I was diagnosed in 2012, and I have been in remission since 2014, but I have long-term effects related to my cancer treatment. And I won't go into many details, but I have taken all sorts of treatments, lots of chemotherapy, lots of surgeries. I took steroids for 4 years continuously. Initially, even today, I have to take steroids at least 3-4 times a year, and lots of other medicines. Azithromycin is very famous antibiotic. I mean, it got famous during COVID, and for patients, we say don't take it more than 5 days, 7 days. And I had taken it earlier for 4 years, and even now I'm taking it daily since 2 years. So, but I'm not saying everybody should take it. It depends on your medical condition. And I have undergone hip surgery, lung surgery, lots and lots of things, cataract. My lungs are today functioning at 28%, and normal person it is 100%. So if I had not taken all those treatments, I would not have any of those side effects. My lungs would have been perfect, most likely, and all the things would have been most likely perfect. But another aspect is, if I had not taken that treatment, most likely I would have been dead like almost a decade back. So, but again, it is not something which I can generalize. So, one thing I want to ask JC, you are, based on current recent post, you are quite obviously against vaccines.
Not all vaccines. Not all vaccines. HPV.
Okay.
Yes.
Okay. So you are not against other vaccines, and because there were some posts somebody asked about childhood vaccines, and I don't want to go personal, but somebody asked, will you stop vaccines for your kids? And you said they have taken ones, but going forward you won't get them.
Yeah, I did that, and that's because I'm doing my own research on all the vaccines. As of now, I have not assimilated data on all the other vaccines. I have assimilated data on HPV vaccines. So publicly, I can say that HPV vaccines, the data does not look very robust, and there's more harm than benefit.
For other vaccines, you will study and
I'll decide for my family.
Yeah,
yes,
that's great. Okay, that's fair. Yeah. So, thing is, you are at least against medicines for chronic diseases. I mean, you said they are not very effective, or they're more harmful than their benefits.
Sorry, I didn't say all medicines. I said most
chronic diseases.
Most of the medicines. Yes.
Most of the chronic disease. Okay.
Yes.
So
for primary prevention. Yes.
Sorry.
Primary prevention. Yes.
Okay. So my question is, medicines for, if we talk about diabetes, hypertension, hyperlipidemia, all these things, they have increased life expectancy or lifespan. People live for 70 years, 80 years, and that is, I'm not saying entirely because of medicines, but they play a major role in that. So why they are not good, or why lifestyle is important, and why these medicines are not that good?
Okay, so first part, I said most chronic medicines, they are not as effective as they are made out to be, because the ARRs are generally 1 to 2%, which means that if you give a drug to 100 people, 1 or 2 people might get benefited, right? And you don't know which ones are those, right? So the probability of somebody getting benefit from a drug is very, very less. And over a period of time, these drugs also accumulate harm because they have a compounding effect in the body. As we have seen in the case of aspirin, for primary prevention, you'd agree that 2022, USPTF, the body, it rolled back the guidelines on aspirin for primary prevention, right? And so we've seen a pattern. As like a chronic drug comes, the early trials become promising, the funded studies report 4x benefits, meta-analysis come, the benefits go down. Over a period of time, more cases of harms come, and then eventually the drug gets rolled back. I mean, even for GLP-1s, you had its predecessor, right? So you have a new version of the drug coming, replacing older drug. So it's kind of a pattern. And then when we look at the absolute benefits, those are extremely low. And there are long-term studies. For example, DPPOS. You have look-ahead trial. You have the diadem trials.
Sorry to interrupt. My question is particularly right now, and we will discuss that definitely.
Sure.
It is like these drugs have definitely reduced mortality.
Again, that is something that we cannot.
I mean, how much percentage it has affected, but they have contributed to reduction in mortality.
We can always debate that, because see, this is also one of the biggest myths I think in modern medicine, is that modern medicine is largely responsible for reduction in lifespan, increase in lifespan and health span, which if you see, it's not true. If you look at the graph of infant mortality, almost 80 to 90% of that infant mortality gains were all due to public health policies, which is sanitation, better water, more nutrition.
Right.
So medical interventions helped, but the contribution is not as large as it's made out to be. If you've read about the social determinants of health, you'd realize that medical care contributes 10 to 20%.
And if we focus on not on like infant mortality, basically on mortality
even
rates
increased lifespan, yes.
For people with hypertension, diabetes, all those lifestyle conditions.
So acute care has played a major role. Okay, acute care. Like for example, if somebody got into an accident, we have become amazing at saving that person from that. Historically, we didn't have that, right? So acute care has definitely saved people from death. So this is almost like if you have an animal in captivity, the animals end up living longer because they can get hunted by prey in the jungle. And there are studies that suggest that, right? Exactly. So if you keep
so you're saying that there has been no impact on mortality or cardiovascular mortality because of the medicines?
Yes, because we have become really good at acute care. If somebody gets into an accident, a road accident, we can save that person.
Not talking about accidents, only talking about cardiovascular issues.
Yeah, if we are talking about cardiovascular issues, again, we are good at surgeries. We can put up stents. And, if somebody has a plaque, if somebody has atherosclerosis, we are really good at operating those people. We are really good at transplanting different organs. So that way we are really good at acute care. And acute care is something which I've always said that is one of the biggest achievements of modern medicine is acute care. It started off as acute care. And chronic medicine is where primarily modern medicine fails miserably.
But in your that video of ARR, RRR, I think you showed that hypertension medicines have impacted, I think...
Less than 1% ARR, that's right.
Absolute, but in relative terms, 20% in cardiovascular mortality?
Yeah, all the drugs you see, they would always talk about relative risk reduction, which could be like 10%, 20%, sometimes even as high as 50%. But you know that relative risk reduction is not it's not that 20% people are getting benefit or 50% people are getting benefit.
Suppose, I think 20-30 crore people are hypertensive in India.
Yeah.
So even if we talk about a relative risk of 20%, so 20% of 30 crore, that would be 6 crore?
No, you'd have to calculate the absolute risk in that case.
No, absolute will be in the terms of whole population. No?
So relative will be in relation to something. Relation to something.
So in relation to people who are not taking the medicines, if we talk about 30 crore people, if those who are taking the medicines, 20% mortality will be reduced in those?
No, that's what I'm trying to tell you. The absolute...
Okay. So, I'm sorry. Let us come to HPV and cervical cancer. We'll come to ARR and RRR later on.
I can clarify it for you.
No, we will come back on that. I want to get clarified. So, we'll talk on that after HPV.
Sure.
Right? I wanted to talk on many things, but as you said, today HPV is and should be the focus.
Sure.
Right? So, I want to start screen sharing. I send you the request. Can you see?
Um, are you sharing the screen?
Okay, I think I have to do something in settings. 1 second.
Okay.
So is this visible?
Yeah, that's visible. Yeah.
Okay. Okay, can you see HPV kind of thing?
Yeah.
Okay. So first of all, I want to say why HPV vaccines are important, or cervical cancer and HPV, and what is the relation and what is the significance. So yes, all HPV infections will not result in cervical cancer. That is very well told by you in multiple posts. So 83% of invasive cervical cancers, which are actual cervical cancer, they are attributed to HPV 16 and 18 strains, which are mostly in the bivalent vaccines. That is one thing. And these are all the cancers which can happen because of HPV infection. Most important is cervical cancer in females, but anal cancer in both males and females, low incidence. But vulva cancer, vaginal cancer, penile cancer, oropharyngeal, oral cavity, larynx cancer, all these cancers can happen because of HPV infection. And mostly it is related to strains 16 and 18. Now we'll talk about the efficacy of HPV vaccines.
So before that, if I can,
Sure, please.
So the data that you're showing, unfortunately, that's my biggest, contention.
No, I'm right now not talking about this data.
Right. Okay.
I'm just telling that these types of cancers can happen.
Yeah.
So now this study you have shown earlier in your post.
Yeah.
HPV vaccination at risk of invasive cervical cancer.
That's right.
And not going into a lot of details, you showed this part. The benefit was 0.51, right?
No, the absolute risk reduction was 0.047%.
Okay.
Because if you see that's 100,000 people, right? So 47 cases per 100,000 people in vaccinated cases, and 94 cases in 100,000. So you minus that, you end up with 0.045% absolute risk reduction. So when you give the vaccine to 100,000 people, you save additional 47 people.
Right. So, but after adjustment for age at follow-up, as this is very clearly mentioned here, the incidence rate was reduced by 0.51.
Now this is, again, like I said, it's relative. This is not absolute rate. This is relative.
Yes, relative only, na? Like compared to people who are not getting vaccinated.
Yes.
Right. That's what I'm saying. Sorry. Yeah. And if you read the whole paragraph, they have adjusted the data for multiple covariates.
Yes.
And they very clearly mentioned this.
Yeah.
After additional adjustment for covariates, it was from 0.51 to 0.37.
Yeah.
And after adjustment for all covariates, it was 0.12. So, I mean, if we have to debate that this data is wrong, that is another aspect.
No, I'm not saying the data is wrong. We just have to put the data in context, sir. You have to give the vaccine to additional 100,000 people. Yeah.
I will come to that. So, this was not a small sample size, and they showed that relative benefit was 0.12, which is like very good. So, that is one thing. Second thing is this study you posted today, right?
Yeah.
So in this also, I mean, if you read the results, it is done.
This is a meta-analysis, Jars Lorenzen, and anybody can check my stories to look at the study.
Sure, right.
Sure.
So in in this also, you can see, just a second. Yeah, so at 4 years follow, right from here, the HPV vaccines reduced HPV related carcinoma in situ. This is not CIN1, I suppose.
No, this is SIN2 and SIN3.
Okay, yeah, SIN2 and SIN3, not CIN1.
Yeah.
So SIN2 and SIN3, again, not every person having SIN2 or SIN3 will develop carcinoma cervix.
That's
but,
right.
I mean, the percentages were already shared by JC.
Yeah.
I will not go into that, but many can develop, not will, but can. So
That's right.
in those who can develop, the vaccine group versus the comparator group, it was 367 versus 490, right? And if you number needed to vaccinate, this was 387, right? So if you vaccinate 387 people, only one will benefit. That is very clear. Then next is HPV related treatment procedures.
One thing we have to make it very clear that this number needed to vaccinate here is for SIN2 and SIN3. And in the Swedish study, the number needed to treat is roughly 2,200.
Right. That is what actual
and that's the actual cervical cancer endpoint.
Right.
So you have to give the vaccine to 2,000 people, and one person will be saved, and we don't know who that person is.
Exactly. And that was for incidence.
I think one of the things that people don't realize is because everybody feels, oh, I've taken the vaccine, so I will have no cervical.
That is a very misbelief. I don't know
exactly
if doctors are spreading that or if people are.
It's become an industry norm, sir, because people are told that, hey, you have to take the vaccine. If you take the vaccine, you're safe from the cancer. When in reality, 2,000 people will take the vaccine. Right. One of them might get sick.
So this applies to every vaccine, each and every vaccine. You take any vaccine developed so far. In future, we don't know what they will do, but so far, if you take any vaccine, it reduces your risk for getting infection and serious infections. But it is not like 100% thing. If you take a vaccine, there is no guarantee that you will not get that particular infection. Be it the childhood vaccines, be it HPV, and it was same for COVID also.
Precisely.
And people can get infections.
Yes, and in this case, if we give the vaccine to 387 people, 387, it might have 1% progressing
from getting SIN2
or SIN3,
not exact.
And you have to give it to 2,200 people to save 1% from cervical cancer. We don't know who that person is.
Exactly.
Right.
And that was about incidence. But if you get cervical cancer or HPV infection, and you have to get some treatment procedures. So in that, the benefit is 1018 versus 1416. That is risk of 0.71, risk reduction.
Right.
And in that NNV, that is number needed to vaccinate, is 75. So this is also very important. I mean, incidence is absolutely important. 387 people get vaccinated, one will benefit. But if you talk about the treatments for HPV related issues, which is the main problem, that is 75. So this figure is also very important. People must understand. And if we talk about actual cervical cancer, this figure will be more than 75. I mean, I have not read that.
We are comparing 2,000 with 375, so you can do an estimate. So roughly,
I mean, if you compare 387 with 2,000,
around 500.
It is roughly,
so somewhere like 400 to 500, yes.
Exactly, it will be much more.
Yeah.
Right. So that is one thing. HPV vaccine increases serious nervous system disorders. This is exploratory analysis. No figures have been provided that how much people actually get nervous issues, which is mostly GBS, Guillain-Barré syndrome, and every vaccine has potential risk of giving you GBS. Every vaccine, almost every vaccine. But that is very, very rare. Most common side effects, if you have seen or if people can read, are pain at the injection site and some soreness, which again can happen with any vaccine you take, not limited to HPV vaccine. And a lot of people recently took COVID vaccine just few years back, and I suppose they can remember how bad was the pain or the soreness. I mean, many people can't move their hand for 1 or 2 days. Many can get mild fever. One crocin is enough for that, or one paracetamol. I don't want to be brand specific. One paracetamol is good enough for the pain or the soreness or the fever. Sometimes somebody can get mild flu-like symptoms for few days, but again, nothing serious. And most people get those kinds of adverse effects with almost every vaccine. So that is one thing. And I'm not saying strength training is a bad thing. It is excellent thing. I always advocate for strength training. Every prescription I make, I mention that people should do strength training. And if you are doing strength training, in that also you can get pain and soreness, those kinds of things, fatigues, mostly when you start doing it.
I don't think I'm contending for the general harms. Like nobody cares about general harms. That's understandable. What my problem is, look at the numbers needed to harm for serious nervous system disorders, which is 1325.
Right.
And if you go from the observational study that we were discussing, the number needed to treat was 2,200. So in this case, because that was the only one that was measuring the cervical cancer endpoints. And this one actually measures SYN3 and SYN2 endpoints. So this is not a true...
Maybe you can check and post what are the statistics for harms or serious harms in those studies later on.
So the observational Swedish study did not report any harms. It primarily looked at
any reliable study, any good study you can post. I mean,
so this study covers that. This study covers that. So if you go down further, so first thing is, look, people need to understand that you can see the NNH is 1325 for serious nervous system disorders. Now this study is all about SYN2 and SYN3, right? So this study is not actually looking for cervical cancer prevention. The other study, which was a long-term follow-up study, that basically accounted for cervical cancer endpoints. And so in that study, the number needed to treat for 2,200, and here the number needed to harm is 1325. If you do this comparison itself, number needed to harm is much lesser, actually 50% less compared to number needed to treat. And just by comparing these two metrics, we can arrive that this vaccine produces more harm compared to benefit at scale.
Let me put out the whole paragraph. Mm-hmm. So yes, HPV vaccines increase serious nervous system disorders in exploratory analysis 72 versus 46. And number needed to harm is 1325, right? But it also continues to say, but it did not significantly increase fatal harms. Which can cause death.
So, which is again, it uses the word, it did not significantly increase fatal harms. Right. But if you can see that 45 people in the vaccinated, 38. Exactly. So, right. 45 people did die in the vaccinated cohort compared to unvaccinated.
People died in the
non-vaccinated cohort, right? So, the vaccinated cohort is indeed producing more deaths. Those deaths could be 19%.
1.2% times. Like 100 people are dying, so 120 people will die.
Precisely.
Right.
So it's again, it just proves that there's harm happening, and not just...
There is possible harm with every vaccine, every medicine you take. Even again, simplest medicine which people know is paracetamol. There is possible harm with that. People can have liver failure with that. And there's a long list of possible harms with every medicine, but most of the approved medicines, with them the harms are very, very rare. And if there are any side effects or any harms with any medicine, they are monitored, and if you understand in time and you report back to your doctor, most of the harms can be managed. I'm saying most of the harms. I told you initially, I have suffered through hundreds of side effects of various medicines, and I can make a whole post on that. And again, if I have to take the medicines again, I will take. And it's not only me. You go to any person who is having any chronic disease or cancers and ask them, how was your experience? Almost everybody will say the experience was bad, but it was life-saving. And if they given a chance, they will take the chance again. I mean, it's individual decision.
Sure.
So yeah, these are the facts.
Right.
So
But again,
they
coming
have
back
possible
to
harms.
so again, even if you discard the fatalities, which has they are saying it's not
1.2
statistically
times
significant.
more risk.
Yeah, but my biggest point of contention is the disorders, like the serious nervous system disorders, which is your GBS, which is your paralysis, and all the things that's happening to people. And you can go through the list of those side effects. There are some, like I said, 25 studies mentioned in this, and this includes all the landmark studies. So you have your future trials and all the other trials which have been done, and we can go through the side effects, and then you can let me know if I'm wrong here.
Right.
And,
so I would request you to. I mean, maybe we can go it today or later on, but let me complete my part.
Sure.
Otherwise, you can. Read those studies. I mean, you have already read. You can put up the absolute risks, absolute harms with these vaccines in the comments or in separate posts. I always want patients to know what possible harms are there. I never try to hide that. I never want any doctor to hide that. I mean, a lot of people who are on Twitter, including lots of Twitter coaches, they probably know me. I was very active during COVID times in the Fitter Care group. I even won your iPad because of being most helpful during one of the months.
I do recall, your name rings a bell, because I remember we've definitely had like a very cordial chat historically. I do kind of recall.
So I was very active there, and almost daily, I mean, throughout the day I was active, and people were posting about their queries related to COVID and what treatments were being prescribed by doctor. And wherever I saw that something wrong was prescribed or something unnecessary extra was prescribed, I was always telling people, okay, you don't need to take that. And in my own practice also, I mean, I can show you all the prescriptions. Every COVID patient, I gave just paracetamol, gargles, steam, or cocktails or something.
So again, this is not me against you or any of the doctors. We ourselves have doctors.
I know this is not very common.
Yeah,
I agree to that, but that is individual problem if somebody is not following the guidelines. But the guidelines in science is not wrong. People can be wrong, and people are wrong in every profession. So science is not wrong most of the time. Sometimes it can be, but wherever science is wrong, it corrects itself. As you only mentioned today in your post and everywhere, they say that this medicine is good, and then after years, they say this medicine is not good, and they change. That is how science works, based on research, based on phase 4 trial, which is after
post-marketing. Post-marketing surveillance.
Post-marketing things. So you were talking about aspirin. Today only I read that even for the secondary prevention, clopidogrel has proven better than aspirin. So maybe in few months they will say aspirin is not good for secondary prevention. So, but that is how science works.
Yeah.
So anyways, coming back to HPV. So I've talked about efficacy and harms. So now this thing. So you showed in this thing in your video about the glucagon data.
Yeah.
Right, and this is not the 1 million study or something, just estimates. They have estimated things in other studies, but in this one, they have actually calculated. They have
based on the registry.
Based on these registries.
Precisely.
And these were the registries till 2016.
Yes.
If you see today, lots and lots of more registries, all population-based as well as hospital-based, have increased, and they are getting more data, but they have not published latest data, which is, I don't know why. They should have done that. And
if you actually click on the source and methods, they clearly mention 3A and 2B. And so the mortality data is not coming from the registry. It's probably coming from. Okay, yeah. So this is the registry, chapter number 8, I guess.
Right. So the thing is, we as a cancer patient advocates also face lots of issues because proper data is not available. we were recently trying to convince insurance companies to provide insurance to cancer patients, but they again ask for data which is not easily available. So yes, registry and data is a problem, but that doesn't mean that cervical cancer cases are not there.
No, I didn't say that.
I will,
I'm pretty sure cervical cancer cases are there. In
I mean,
fact,
not enough.
My point is that the current data looks exaggerated. Like if you, I mean,
Okay, yeah, I'll-
went through the registry. You can open the registry yourself. It's the
Right.
registry,
So-
right? If you can scroll up.
Yes.
Yes.
This one, I
Okay.
know.
So this data is there. So there's 28 registries. Yes.
I will try to explain on this.
Yeah.
Hopefully, you and the audience gets what I'm trying to explain. So this data you showed, and you said this is almost 20,000.
21,000.
Total?
21,000. Yes.
And so, if we calculate for 1 year, it was 4,000 and 10% multiplication factor, 40,000.
Yeah, I mean,
right?
that was just a linear this thing, but
Right.
we don't have to do a linear this thing. We can do a ARR, so which
So-
is mentioned next to it.
Right.
The age adjusted.
So
Yeah.
exact one point I want to put before that, exact number is not 20,000, 21,000. It is 23,619.
Sure.
And if you divide it by 5 and then multiply by 10, it comes more than 47,000. So
Sure.
huge difference between 40,000 and 47,000. I mean, that is really huge.
Right. I mean, they are saying it's 121,000.
I'll come to that.
Yeah.
So first of all, this is 47,000, more than 47,000 something, 300 more than that, not 40,000. And for calculating the incidence, they have taken age-specific rates,
Yeah.
which they have mentioned
Yes.
in the
AR.
next one.
No, I'm aware of this. So they have not taken the crude rates. They have adjusted for
Right.
age. Yes.
So let me try. I don't know, this bar has come. Okay, I'll have to close. I mean, this bar is coming on top of it. I want to. Do you know how can I remove this one?
Just click on them, sir, and then you can click on the cross button next to it. Just click on any of the bars.
Okay, no.
Yeah.
Right.
You'd see the cross button. Yeah.
Yeah. So this is the last part, 14 chapter in that NCDAR data, right?
Yeah.
So this mentions here the limitation of the methodology is that
Yes.
it assumes constant incidence rate for future as a conservative approach.
Yeah.
PBCRs cover close to 10% of the population.
Yes.
So that's why we multiplied the data by 10.
By 10. Yes.
And many parts of the countries are not covered.
Yeah.
So again, the limitation is a lot. I don't know, government is not so much focused on these things or whatever the reason, but the data collection registries are very much limited.
Right. My team, by the way, for everybody's information, has filed a RTI query with ICMR. So hopefully they should reply back and share raw data
Right.
with us.
Right.
Yeah.
And those things are very good that you are doing. I really appreciate the part asking questions to everybody, doctors as well as authorities. That should always be done. So yeah. So many parts of the countries are not covered, and this is from 2016.
Yeah. 2012 to 2016.
Right.
Yes.
So the influencing factors such as risk factor or risk behavior, case finding procedures, screening programs, improved technique for detecting cancer patients are likely to influence the projection of cancer cases. So they have, according to their calculation, it was 47,000, but because of all these factors, and that 47,000 was average of 5 years, right? So
Yeah.
assuming that things increase year on year, the registries as well as the screening procedures and all these things mentioned just now, probably the data for 2016 was, the incidence rate for 2016 was more than 2012. I'm just assuming that. So for 2016, what data they presented, and also it was age specific data. What we discussed was not age specific. The age specific part was more than that. They have it here also. So this is also not age specific data. This is AAR, and age specific is something else. I won't go into the details of that. But yeah, these are more than group numbers usually. somewhere they are lesser than crude numbers also.
Yeah.
I mean, I am not a statistician. I don't understand all these things that much, to be honest. But assuming the data provided is correct, that is the scenario. And because of, I'm sorry, again, this is here.
So have you looked at the registry incident trend also?
Yes,
Yeah.
I'm coming there. This one. Right.
No, not this one. The big one. The before the PDF, the chapter number 8.
Okay, let me come back.
Yeah, that's the one.
Yes.
So if you go down. No, I mean.
Yes, I understand what you're saying.
Right.
The incidence rates are decreasing, right?
And many of the registries.
Yes,
exactly.
Yes. Yeah, this is also very interesting and important thing. Yes, you can see in Mizoram and Aurangabad and slightly in Sikkim, the incidence of cervical cancer was increasing. In Kamrup urban, I don't know where that is, it was same. But in all other places, Dibrugarh, Bangalore, Bhopal, Mumbai, Pune, Delhi, everywhere the incidence of cervical cancer is decreasing as per this data.
And this is
So
before the introduction of HPV vaccines, and this
Right.
actually aligns with global trend.
No,
because if you
HPV
see-
vaccines were introduced in 2006.
No, I mean not in India.
Okay.
Not in India. In India, HPV vaccines were not there. So, like the first time they did trials in the 2013, the Bill Gates and the controversy, and then they were rejected. So, HPV
So
vaccines.
when
were
were
not
they
there.
introduced in India? I'm sorry, I don't know.
So the first time they were introduced in 2013, and when they did the trial, and then after that, now it has started coming up. Like
Okay.
I think they've been around for now a couple of years, but not far back. Definitely not in this period. And this actually aligns with the global trends, because if you see a lot of people say, hey, we reduced the cervical cancer in Australia because of the HPV vaccines, when in reality 50% of HPV cervical cancer cases were already down before vaccines came. In fact, majority of HPV cervical cancer in US decline was before HPV vaccines, and people say it's because of condoms, it's because of higher screenings, it's because of earlier treatment. So I'm saying, hey, look, if there are countries which are showing clear pattern of reduction in incidence trends, which we see here also, are these population really requiring vaccines, or maybe more focus on screening interventions, more focus on safe sex awareness, because we can clearly see that the margin of decline is not trivial. Some of the places it's pretty high, like 0.4% minus 5.7%. That's pretty high. And if you then you start weighing it on a trend basis, then you don't say that these numbers are increasing. The right answer is we don't know.
Fair enough.
We don't know.
So yes, HPV, I mean cervical cancer incidence is decreasing as per this data and as per many other data all over the world, and this is for India. So yes. Okay,
I mean, you can actually just do a quick search because you have your internet open. So maybe you can check in the US HPV.
No, I know that is increasing. I totally agree on that. There is no contradiction on that.
Yeah, before the vaccines were introduced, in majority of the part of the world, HPV cervical cancer incidences were already down by almost 50%.
Down, right.
Yeah, at least in Australia I know, in UK I know, in Sweden I know, in Denmark I know, and a couple of other countries. And now we have the similar kind of trend in India. At least this is for the period 2012 to 2015. If they are increasing now, we don't know that. But from
they are reducing. They are reducing.
Okay.
I'm sure. I mean, I don't have exact data, but I'm sure because the cervix cancer is more common in rural areas for hygiene and many other issues, which I will come to later on. But I don't have exact data, but I suppose based on the causes of HPV cancer and other things, the incidence must be reducing from previous years. So this is cervix uteri, cervix cancer, and this doesn't happen in males, so there's no data for males. And for females, you can see.
By the way, they are pushing HPV vaccines for males also now.
I'll tell you.
Which is again a big problem.
I showed you in the first slide only that HPV infection is related to many cancers, which can happen in males also.
Right, but we don't have studies specific to.
We know today.
Yeah, but we don't have studies specific to those
Yes,
males?
yes, we don't. We may
Yes.
not have. I have not looked into that.
Yeah.
So this is 2016, which we calculated 47,000, average of 5 years, but here they have shown 67,000 based on age-specific data calculation. I won't go into those details, but progressively they have increased numbers every year.
Which is also my question. Why?
I'll tell you.
Yeah.
67,000, 69,000, 71, 73, 75, and for 2025, 85,000 they have projected. This is not the exact figure, but this is the projected estimate for 2025, right? So now coming back to...
1 second, sir. Somebody is saying that Gardasil was available
and
since...
Please don't call me sir.
Okay, yeah. All right, Nikhil. So just somebody is asking, Gardasil is available since 2008 and having state-specific vaccination programs since 2016. Yeah, okay. So they might be having vaccination programs from 2016 onwards, and maybe it was available in 2008, but I believe not everybody was taking the vaccines because there was no state sponsored programs, and these vaccines, when they launched, they were like 30,000, 40,000. They were pretty expensive.
Right.
And
even yeah. Recently these were...
And even the decline in incidence rate, so the decline in incidence rate has been coming, the incidence numbers have been coming down since 1990s. So then how do you explain that period? Like even before 2008, the numbers were declining.
Yeah. I'll tell you. So this is the thing. I mean, this is also a study. You can check if it is good enough or not. Status of cancer screening in India. This is based on NFHS 5, yeah. 5, right? And this was published in 2022.
Right.
But the data it is based on, that is from 2019 to 2021.
Yeah.
And it clearly mentions here percentage of women who have undergone cervical cancer, breast cancer, and oral cavity screening were 1.9%, 0.9%, and 0.9% respectively. So for cervical cancer, the screening rates were 1.9% till 2021. So, I mean, I don't use any AI so far, but I did a normal Google search and it showed me women population in 2021 was 66 crore. Mm-hmm. Maybe you can verify that. And if you calculate 1.9% of that, that gives 1.25 crores. Mm-hmm. So only 1.25 crore women were screened in 2021. And that 66 crore also includes, I mean, I suppose if I typed women, it would also include young girls also, which are not screened.
Sure.
So if we take just women above 30 years of age who are generally considered for screening program, the figures would be even lesser than 1.25 crore.
Sure.
So that is the thing. And recently in last few years, the screening programs have increased a lot. One, awareness is increasing. Secondly, government is also working on cervical cancer a lot because the program to launch cervical cancer vaccine has been going on for a long time, since many years. Government is working on that. I mean, vaccine was available earlier, but to include it in the vaccine program and make cheaper vaccines available, that is going on since last few years. And this data is from Government of India, Ministry of Health and Family Welfare. You can see this. And this is posted on 26 July 2025. I mean, again, I don't know how true the data is, but if we trust the government data, which is available, these are the figures. 10.18 crores women were screened for cervical cancer, right? So earlier 1.2 crore or even less if we consider age more than 30 years. And now it is 10.18 crore, almost 10 times. And the period from in when this screening was done, this is here 20th February to 31st March 2025. And I mean, reason they have given is obviously to accelerate screening efforts for individuals aged 30 years and above. So the screening programs were not only for cervical cancer. This is a government initiative which works for many non-communicable diseases, and I will show you that later on. Yeah, this is National NCD portal, non-communicable diseases, and they are working for many conditions, including hypertension, obesity, diabetes, and several cancers, stroke, and few other things. But this data is for cervical cancer. I will share the link. I mean, you can also find, so you can verify this. So, I mean, this is very simple thing to understand. If you are screening 1 crore people and if you are screening 10 crore people, even if the incidence is reducing, the people you find out to have particular disease will increase. And there is no.
It will not affect the incidence rate, sir. I mean, the incidence
That
rate
was-
we
that was
calculate on the
incidence
basis
rate.
of yeah,
That was incidence rate in 2016.
and that's what we project.
And incident. How do you calculate incidence rate?
whatever is it, you just calculate
That-
it
that
per
was based on the
100,000 people.
registry,
Yeah,
right?
Per 100,000 people.
Those were based on the registries.
Yes.
If the registries are, just suppose if there were 30 registries and now there are 50 registries and the screening is increasing, they will obviously identify more people.
Yeah, they'll identify
Having the
more
disease.
people and we'll have more percentage representation. But that does not
So
mean
if
that.
percentage representation will increase,
So let's say earlier the percentage representation was 10%, and now because they have screened so many people, maybe the percentage representation went up and now it's 20%, 25%. That
right?
representation is changing. That does not mean necessarily the per 100,000 incidence rate is going up, because we've seen
Not
that
necessarily.
Yeah.
Not necessarily, but I will. Show
because
you
we've seen declining trend. So unless until we have data
I'll
that
show you
shows
one more data.
sure.
So yeah, okay. So that was from 2025.
Right.
This is the latest, posted on 23 March 2026. So 3 days back, again from Ministry of Health and Family Welfare, and this is PIB Delhi Press Information Bureau. 8.73 crore women screened, and I looked it up. This was, I think, done in second half of 2025 or first half of 2026. So when they screened 8.73 crore women, this is above age of 30 years. I'll show you the data for this. And yeah, this is what I was mentioning earlier. This is NPNCD program, National Program for Prevention and Control of Non-Communicable Diseases.
So
And this is focused on, one second, diabetes, hypertension, oral cancer, breast cancer, cervical cancer, kidney disease, myocardial infection, and all these things. Yeah, sorry.
So even if we look at this specific update from the government, which is the most recent, I guess 2026, right? It says 8.37 crores.
23rd.
Exactly. It says 93,062 cases diagnosed. So this is 93,000 cases, and if you apply, let's say, a 50% mortality, you still have 40,000
I'm not
deaths
talking about
annually.
mortality right now.
Yeah,
Just,
even then, this is still very far off from the Globocan estimate.
Right. So they have screened just 8,73,000 women, and out of 8 crore 73 lakh, they have found 93,000 cases to be having cervical cancer, and this is not SIN 1, SIN 2, SIN 3. This is actual cervical cancer.
Okay,
So
I'll have to look into this, because have they shared the data or anything? Where are they getting the data from?
I could not access.
Okay.
They might be, and there is, if you go to that same website, now which we were discussing later.
Yeah, because I'll tell you one thing. What has happened is that if you go to data.gov and if you actually check some of the queries which were raised in Rajya Sabha, and so again, this
I know
is
they
where
have not provided the data.
yeah, so they've provided a data, and then I fed that data into AI, and I said do a pattern recog, and then I realized that they have actually done they've taken a growth factor, and they've just multiplied that growth factor to each year's numbers to arrive at a number, right? So that's where I'm also like, see, unless until we have the base data or the raw data, we cannot assume that this data is true, because historically, if you go to data.gov,
I already mentioned this. I don't know if the government is giving false data. I can't verify that, and I can't take any responsibility for that also. So it is up to people to judge if they trust the government is providing correct data, or if they can verify it, they can take their decisions accordingly. And if they think the data is wrong, I mean, this data is provided by government, not created by me. So if they think the government is providing wrong data for whatever
Can we
reason,
check the
they
source
can,
for this data at least? What is the
I
source
got
for
it
this
from
data?
some cancer groups, but this is easily available on if you check NPNCD program or Ministry of Health and Family Welfare, you will get this.
NPNCD.
So,
Okay.
right.
I'll check if I can.
Right. So let me just say, if this data provided by Government of India is correct, so when they screened for cervical cancer 8 crore 73 lakh people, women above age of 30, 93 were found to be having cervical cancer. And again, from normal Google search, I think almost 50 crore population is of women in India. So you can see, I'm not saying that you can straight away multiply.
Yeah, I don't think
These
they have
programs-
mentioned any
these
source
programs,
for this. Yeah.
Screening programs. Okay, this is also one thing important. This prevention, control, and screening services. These were done by ASHA workers and auxiliary nurse and midwives. So these are mostly concentrated in tier 2, tier 3 places. So this data is representative more of rural areas compared to urban areas, and cervical cancer is more common in rural areas compared to urban areas. So probably if you screen 8 crore women in urban areas, the numbers of cervical cancer will be lower than this. So you cannot straight away multiply with the population and say that there are 4 crore people, women with cervical cancer. That will be wrong. But yes, if 8 to 9 crore women were screened and 93,000 were found to be having cervical cancer, you can very well say that if you screen all women above 30 years throughout the country, 1,27,000 cases are very easily imaginable, and it will probably be much more than 1,27,000. So that is one thing. So far we have talked about efficacy, that yes, these vaccines are effective relatively compared to if you don't take anything. These
The harm.
have possible side effects, and
At a mass level, if we compare the observational data from the Swedish registry versus if we check the meta-analysis, which compares the harm, you can see that.
Yes, I was saying that only. Yeah. You can make a post about that serious neurological harm. Yeah. That is something we discussed already. But most people, for them, the harm is injection site pain and soreness. And I mean, we have discussed all that. So people have already heard and they can make their decisions based on that. We have discussed that cervical cancer is important. It can happen in women as well as, I mean, not cervical cancer in men, but other cancers can happen in men, which are related to HPV infection. And these are the data provided by government. So the figure of 1,27,000 women having cervical cancer is very much imaginable. And
so let's do one thing. Let's do one thing. I want to do something really quick, because sure. I'm suspecting that even the data that the government has provided is probably just modeled data. Let me see. So, for example, they had raised this question in Rajya Sabha, and this is from 2017 to 2021. And let me just do this quick. jc@fitter.com.
So again, if the data was from before 2021, government has increased screening programs much vigorously after that.
Which is what I'm suspecting. If they have, like, where's the source? Because where's the data? Where's this data coming from? Which is
this data, I don't know where you can get. I've also asked many people who may be in a position to provide the data. And if I get that data, whatever it is, I mean, I'm totally unbiased about this. I'm not saying that you should get vaccine or you should not. I'm just presenting facts which are available to me. So if I get some data on cervical cancer and that's concrete latest data, I will definitely share it. So for now, this is the data what we have. And again, HPV vaccine is not something which you have to get today only. You can take a few months to decide, and in that time, probably data will be accessed by JC or me, and
So-
you can see and decide accordingly. The age group for vaccination, the target age group is 9 to 14 years. So you can take few months and take the vaccine.
Sir, if you can kindly click on this screen. And this was in response to a question asked in the Rajya Sabha. I've put it in the chat.
It's not, I don't.
Yeah. So okay. So I'll tell them. Not a problem. Where is it? Yeah. So if you look at this data, this basically, so you can see that this data is looking. It looks like a legitimate data, but then you open AI, and let's just do this thing. And I say do a pattern recog and see if there's a growth factor applied. And very quickly the AI checks and tells that pattern is mechanically consistent. This is not organic epidemiology. It behaves like fixed growth function applied across states. So year-on-year growth numbers, you applied a factor of 1.0262, 1.0255, 1.0256. So basically what they have done is they have for every single state, they have applied a growth factor. So these are not actual numbers. And if they are not able to...
available before 2021, we are talking about that, right?
Yes. So if they have done that for older data, I'm not sure if we can trust the government to do for the new data unless until they provide us the raw data. So I'm looking at the source for this data. When the government is saying they have screened these many people and they have diagnosed these many people, where is the data?
Right.
Where's the state-wise data? Can they provide state-wise data or like a dashboard? Because a lot of times government says they have done something when they really haven't done anything.
Right. So if we go on the NCDIR website where there are things about registry, I have not saved the link, but there is something like these registries are working every year, and there are details of the meetings every year. And
I've seen the maps and the hotspots. Yeah, I've seen the maps and hotspots.
They have not published that data, but they have also mentioned something, a disclaimer that this information should not be shared on social media or anywhere. So I have not taken that thing, but individually people can go and check, and I don't know if you may share, but I won't share those things. But okay, can we continue on this part right now?
Okay, sure. So we need the source for this data.
Right. Then, okay. So right now, according to Ministry of Health and Family Welfare and Press Information Bureau data, these are the number of women above age of 30 which have been screened, and out of this, 93,000 have been found to be diagnosed with cancer, and 78,676 are on treatment for cervical cancer. So it is possible that they wanted to start HPV vaccination, so they worked aggressively on screening and they found out more numbers. It is possible, but let us not.
Generally the pattern is that you have to mention, like you can't just screen people and then just say, okay, these many are diagnosed, because it's a perfect opportunity for you to also find out localized hotspots. Because as we've seen in the NCDIR report that there are hotspots, there are places where incidents are going up and there are places where the incidents are coming down. And so I think if the government has not published that data, it's a huge missed opportunity, right? So at this point of time, there's more questions regarding the data than an answer. Because right now this data does not give you a split.
Yes, again, yeah. It depends on everybody, their level of trust and perception. If you trust the data, this is it. If you don't trust it, then
Yeah, we'll have to file an RTI, yes.
Right. So moving on from that, one thing I want to ask people, and again think about that, there are so many cancer, almost every body part has a cancer, can get cancer, and this vaccine for cervical cancer HPV vaccine, this is present since 2006. Maybe not in India, but it has been developed 20 years. But they have not developed or talked about any other vaccine for any other cancer particularly. So if the only purpose was to make money or to infect people or to cause harm to people, or maybe as some people say to cause infertility, they could have developed vaccines for many other cancers. And if the data is also fabricated, they could have produced data for many other cancers which have much more incidence than cervical cancer. And maybe they could have introduced vaccines for multiple cancers. So they would have earned much more. They would be able to harm much more people. A lot of people commented, not a lot of people, somebody commented on your post that once they reach a very high level of wealth, they don't have, need for more wealth. So they start harming people to enjoy something like that. I don't remember exact words. So if that was the purpose if the purpose was just to make money, they could have introduced vaccines for many other cancers, multiple cancers.
So
in this study also,
yeah.
you can see, so oral cancers, 2,14,000 cases diagnosed. In breast cancer, 77,000 diagnosed. And these are just 3 cancers. There are so many cancers. They could have given vaccines for, again, and vaccine doesn't mean you can't get cancer or you won't go for screening or you won't go for treatment. They could have earned that way also, and they could have earned through vaccines also. They could have introduced vaccine for so many things. Another thing is, this vaccine was available in India since many years, and it was very costly. Even recently also, when I checked, few months back, I think one dose was something around 8,000 to 9,000. But now it is being provided by government free of cost. Free of cost is not exactly free. Money is going from our tax only, but at least you are getting it for free. And this is voluntary. This is not, COVID vaccine was compulsory. There is another aspect to that we can discuss, but this is voluntary. If you feel this is good for you, you take it. If you feel this is not good for you, you don't take it. Nobody is forcing you. Yes, they are emphasizing on it. Government is emphasizing, doctors are emphasizing, but nobody is forcing. And this is free. So it is your decision. If you think this is not good, it's okay, your choice. But then your choice and consequences are also your. If you think harms are more, then you will be better without taking the vaccine, then also it's your decision. But these are the facts, that cervical cancer incidence is quite high. Cervical cancer vaccine, HPV vaccine, this is effective, and for most people the harms are very minor. About the serious brain harms you will post, so except that part, I'm saying. And HPV infection is responsible for almost 83% of cervical cancer cases. So these are the facts about vaccine and cervical cancer. About the serious harm of neurological aspect and the validity of the data, this is an open question, and JC can find out on that. You can yourself also find out on that. And that is from my end mostly about HPV vaccine. There are a few more things about cervical cancer which I will say, but yeah, you were saying something.
No, I was saying, so again, like we've seen the other studies, and one of the things that we also have to inform people is that there has never been a placebo-controlled randomized controlled trial, and the absolute effects, as we've seen in the Swedish registry, when we compare for the cervical cancer endpoints, are extremely small, which is like 0.047%. And again, somebody can say, oh, we followed up and ARR went up. Well, sure, maybe they
0.12%.
Yeah, maybe let's say they are 0.12%. But then here we also have the meta-analysis, the Jars-Lorson meta-analysis, where it shows that the risk of mental neurological disorders is actually statistically significantly higher, right? So, and it's almost like 0.5 right? And NNT is the number needed to harm is roughly around 1400 or 1300 something, wherein in the Swedish registry the number needed to treat was 2200, right? So that way, if you give the vaccines to, let's say, 100,000 people, the net harm exceeds net benefits. I mean, that people have to understand.
And number needed to vaccinate was 2,000 for
2,200.
incidence.
2,200.
But if you calculate number needed to vaccinate to prevent treatment for cervical cancer, that would be somewhere around 400, 500. I mean, that was the second part in that thing I showed you. This one. So HPV related
No, but this yeah.
procedures,
So this
is 75, and if you go on according to 2000, it will be more.
No, but again, see, in this case also, who are the people who are going for the treatments? Are these people at what stage? Because again, this study, the studies
So
that were
it
in
can
this.
be because this study included SIN 1, SIN 2 also.
Yes,
So
exactly.
the people will be going for treatment procedures will be
Exactly,
SIN
and
3
we don't know the
cervical
extent of
cancers.
those procedures. Like, for
Right.
example, if you have SEN1, the lesions can be very easily removed. Those are not chemotherapy or.
Right.
Yeah, so this is
So
you
SIN
would
2,
agree
SIN
that
2 and SIN 3. For SIN 1, most likely nothing
exactly.
is done. It is
And
generally
even for
put under
SIN2,
observation.
yeah, even for SIN2 and SIN3, the procedures are far less invasive compared to, let's say, somebody going on a cervical cancer, like a radiotherapy or a chemotherapy, in which case also the
Right.
chances are 50%. The mortality is not 100%, it's 50%, right? So I'm saying that we can't use this number in that context. Because these procedures, we don't know what are these procedures. Are these simply removal of lesions? I mean, in this case, I think it would be largely that, because they were not comparing cervical cancer endpoints.
So in SIN 2, it will be removal of lesions. But if you go for SIN 3 or cervical cancer, the procedures are,
Right. So then we'll have to
really
quantify.
morbid.
Yeah. So then we'll have to quantify how much is SIN3.
Right. So, and one more thing, you talked about mortality. So, again, everybody can have their own perspective, but somebody who has gone through cancer treatment and its major side effects and gone through enormous treatments, and I keep talking to cancer patients every day. A lot of people connect me through, they see I have few videos on my YouTube channel and little bit active on my social media, and other people also know. So they connect me and they talk to me, and the morbidity of cancer is really, really bad. Mortality is important, but compared to mortality, morbidity is much more important according to me. For understanding of general people,
Sure.
People, mortality is when you die, and morbidity is when you have some particular disease or condition, and the quality of life that you have with the disease.
Yeah.
Just suppose,
Agreed.
for my example, I got the disease in 2012. I am alive today till 2026. So yes, my mortality has reduced, and for any cancer, 5-year survival or 10-year survival is a great achievement, which I have crossed. But if we talk about quality of life, anybody who will directly see a cancer patient going through the treatment or after effects I am sure they will definitely get HPV vaccine or any vaccine, because unless you see how bad your life becomes and how toxic is the treatment, you take anything, chemo, surgery, radiation. These are really difficult treatments. I'm not saying you should not take treatment. Yes, if you have the disease, if you don't take the treatment, your chances of survival are very, very, very less.
Yeah.
Some miracle can.
So the point being, but the point being,
just a minute.
Sure.
But if you get any cancer and you have to undergo the treatment part, that is really difficult, physically, mentally, emotionally, psychologically, financially. Most people in India don't have insurance covers, and once you get cancer, no company will give you insurance. You are on your own.
Yeah.
Those who are very, very rich, they can afford. Those who are very poor, they might get some government schemes, but majority for the upper middle class, lower middle class, you are on your own. And any cancer, 10-15 lakhs is the minimum cost, and it can go to very high, depending on multiple factors. Yesterday night only, one cancer patient, blood cancer person called me, and age is 23 now. When he got cancer, he was 21, and his case was very high risk. He is undergoing treatment since 2 years, but even now he has relapsed and he is looking for the treatments. He has spent almost 50 lakhs, and the next possible treatment for him will be costing 50 lakhs more. And the physical morbidity, emotional, psychological. I'm not saying all this to.
Sir, I think what's happening is we are
convince you to take the vaccine. But I'm sorry. I need few minutes more.
Sure.
But I'm just telling you, this is not something like fever or any infection or anything which you can take chances. This is something very serious, very big problem. Anybody, JC, I'm telling you, to you also, you go to any cancer ward in any hospital and you talk to any patient of any cancer. And I'm saying this for people also. You go to any hospital, talk to any cancer patient, and you will know what it means, and then you talk to them, okay, these are the possible harms and these are the possible benefits. Should I take this vaccine?
Sir, I think what we have to balance this against is that there are neurological disorders which are even worse. So why are we?
But
so for example, Guillain-Barré. No. So in this case, if you see, if you read through the lines, it says the HPV vaccine increased serious nervous system disorders.
Right.
And the RR is 1.49, right? So it's almost
exploratory analysis. This is not
no, because see, exploratory analysis as in they have not done because nobody is going to do a causality study, right? So we have to look at the incidences as face value.
See, if we can doubt government published data, and we can't say that this.
No, this is the data taken from pharmaceutical companies. So this is a meta-analysis. So they have taken these incidences from the trials which the pharma companies have done. They have not made up this data. So they are saying 72 versus 46, relative risk 1.49, which is 50% more neurological disorders in the vaccinated group compared to unvaccinated. We don't have treatment for Guillain-Barré syndrome. We don't have treatments for paralysis, so it's equally worse. See, in cancer, you still have options available.
I would request you to please find it out, and I will also do, and provide some concrete data on.
Sir, it's right here, It's right here. This is a meta-analysis. It's right here. It clearly says the number needed to harm is 1325.
I will go through this. I have not checked this so well, and I will present that data definitely. But yes, again, I don't want anybody to be misguided in favor of vaccine or against vaccine. These are the things, and you should take your decision. So
right.
I will come to another part of cervical cancer very quickly. I'll try to finish that. So that part is this part. So if you don't want to take vaccine for whatever reason, if you are absolutely convinced that vaccine is not good for you, there is something else you can and you should do. So little bit about HPV. I mean, we have discussed this already. This is a common virus occurring in men and women, and it spreads through sexual intercourse. It usually clears up, you have pointed out a lot. HPV infection doesn't mean you will get cancer. It usually clears up on its own, but sometimes infection persists and it can turn precancerous in few years. If left untreated, it can turn cancerous. So this is what we were talking about, SIN 1 and SIN 2 for understanding of everybody. First thing is you can get HPV infection with the sexual intercourse. If you get HPV infection, usually it will clear up on its own without requiring any treatment. If it doesn't clear, it persists, you can get SIN 1, SIN 2, those kinds of things. And in some cases, those SIN 1, SIN 2, SIN 3 can turn into proper cervical cancer. So you have already emphasized on that, and that is fair point.
Yeah. No, regular screening, using condoms, performing safe sex.
So
I mean, that has historically
I'll elaborate that.
worked, and so that will continue to work. Yes. So that part is nobody's debating. Yes.
These are the risk factors for cervical cancer, which everybody should understand. This is more important than anything related to cancer risk factors and screening.
Yeah.
Infection with high risk HPV, which we have already discussed. Early age of marriage or early age of initiating intercourse. So the first part, early age of marriage, is more common in rural areas and lower tier cities. And early age of intercourse is, again, early marriage most likely means early intercourse. But even in urban cities, even if age of marriage is, going way ahead, 30s and even later, but intercourse is happening at much earlier age. Everybody knows a lot of girls get their first intercourse in 17, 18, that age nowadays. Not everybody, but a lot of. So that is a very high risk factor. First child before age of 20 years. Again, early marriage most likely means pregnancy at age before 20 years, and in rural areas, frequent births with less spacing between them. Poor genital hygiene, which has improved, and so the incidents have decreased from previous years. Multiple sexual partners, unsafe sex, very common everywhere in rural areas or urban areas. Tobacco use, again, very common among rural women in form of zarda, pan, gutka, and smoking is also very common. Hookah is also very common in urban areas. So if you don't want to take HPV vaccine for any of your reasons, be sure to avoid all these things, which I don't see happening very easily, very frequently, because nobody is for stopping smoking for so many harms it can cause. So I don't know how many are concerned about cervix cancer. So practice safe sex, use condoms, which again very few people do, multiple sexual partners and all these things. So if you're not taking HPV vaccine, be aware of all these things, please. And even if you have taken the vaccine, even if you are taking care of all these things,
that's important.
Get proper screening. Again, every prescription I make for women, I mention about screening for cervix cancer and mammogram for breast cancer. But let me tell you, I don't, in my practice at least, I don't see even 5 to 10% of women doing that. Almost everybody is going for these blood tests, which are being promoted a lot. They are important, but they are not so much required as being
for
promoted.
For cancer, yes.
For anything, the blood tests I'm saying, the regular LFT, KFT, all those things, people are getting those very frequently, and lots of tests which are not even required. That's a separate issue.
For cardiovascular risk, what else you do?
They are not required. They are not required so frequently as people.
Right. Yeah. Of course, that I agree. Yeah. You don't need them so frequently. And a lot of people are going for so many tests like what you say, lead level, mercury level. Lots of tests. I can go on that. Fair.
So they are important, but I'm not saying they are not important. But these cancer screening tests are also very important, extremely important. Screening is visual inspection by acetic acid. This is a very low cost test. It can be easily done, no intervention. Nothing will be poked into you, no syringe, no invasive thing. And another common one is Pap test with HPV testing. So in Pap test, they take a sample in your cervix and see it under microscope if there are any cellular changes like SIN1, SIN2, all these things. And HPV test is a DNA based test. In that, in the same sample of cervix secretion, they see if there is presence of HPV DNA. And HPV DNA, as we have discussed, it increases your risk for cervical cancer. So if HPV is positive, then your gynecologist or oncologist will advise you accordingly. So again, if you are not convinced, if you are not okay with taking vaccines, please take care of all the risk factors. And whether you take vaccine or not, definitely you have to get screening test. And we mentioned this initially, I mean, earlier in the part of discussion, that no vaccine gives 100% protection. It reduces your chances. So even if you get the vaccine, you should undergo the screening test. And when I was active on Twitter, this thing also I want to say, I made one document about cancer screening test. I don't know if it is there or not.
Did you post in the care group or the Twitter group?
I don't know. It was added in the file section.
But we had during COVID, we used to have a separate doctors group.
Yeah, I remember. I think it should be there. I think it was uploaded in the main file section.
Okay.
Maybe you can check that. That was based on information available till that time.
Sure.
No major changes have happened in screening since then. And I mentioned about all screenings: cervix cancer, breast cancer, all types of cancers. And this I have to say, whether you like it or not, that post, you promote a lot of things, you talk about a lot of things, and it's good you are educating people a lot. But you or anybody, nobody is promoting or talking about cancer screening and risk prevention. It is good if you are questioning science, you are questioning government, you are questioning doctors, and you are presenting data on HPV vaccine and all possible harms and everything. But as a responsible person, when you are sharing those things, you must also share these things, that if you don't take vaccine, at least do regular screening. I mean, you have a huge following and people trust you, believe you, and I mean, very, very frankly, if I tell 20 or 100 patients you go for screening, hardly 4 or 5 will go. And if you say 200 people that you go for cancer screening, definitely at least 20-25 will go. I'm sure on that.
I'll tell you the reason for that. Okay, I'm 100% believer of screening. In fact, in our Pune diagnostic lab, we also do pap smear. Right. The problem is, the minute I do that, people will assume this is conflict of interest, and I'm pushing that. And that's why I never promote any of the things that we...
Even before starting your lab is very recent thing.
Yes.
Even before that, it was not there. And,
no, I was not aware.
And for conflict
it was not my... something
for conflict of interest, you have posted many times about getting blood test, about benefits of heart rate, about benefits of Sense Pro scale. So you have bigger conflict of interest there.
Fair point. I will make a point. It's the cancer thing. I've just started working. I just started speaking about this thing for the last 1 week, I guess.
Still, this is something.
I will make a post. I promise.
I have a complaint and I have a request.
I will do that.
Okay, if you have not done it so far, I mean, it's okay. But going forward, please do that.
No, 100%.
And you are doing only pap smear. You are not doing other cancer screenings.
We will be incorporating mammograms. So that we are expanding the lab. So we'll be doing mammograms. We'll do pap smears and everything.
Please tell people to do that.
Sure.
If you earn from that, I will be happy. I would like you to earn a lot from those screenings, because that means more people are getting screened and more people are getting diagnosed early. So that is something. Even if it is conflict of interest, it will be in the benefit of people.
No, 100%. I think, that's a fair critique. I believe I should have posted. And here's I'm accepting that. I think prevention works 100%. It's great. Screening has already proved successful in the past. In fact, in the US, if you see, they started cancer screening way back in 1950s and 60s. And majority of the incidents, like the decline in the cervical incidents, could be attributed to a mix of screening, the safe sex, sanitation, and awareness. That was what resulted in the massive decline much before HPV vaccines became common. I mean, if you see majority of the...
It is for all the cancers. In US and Australia, you talk about any developed country, cancer screening, particularly mammogram and pap smear, all these are very routine things. Even colon cancer cases are increasing rapidly, even in people of 40s or 50s, and hardly anybody gets colonoscopy here. But in Western countries, colonoscopy is also done very routinely.
Very routinely, yes.
And even if somebody doesn't want to get colonoscopy, stool test is also very helpful in diagnosing it early.
Yeah.
And which doesn't even cost much, and it is not even
it's very
invasive.
cheap. Yeah.
So yeah.
No, I think perfectly
So,
fine. This is a
one
good
thing
session.
I want to ask you,
Sure, sir.
and it's not exactly personal, but it is a bit personal. As you say, you are doing pap smear, and maybe not many people are coming so far. I don't know, but the pathologists and the doctors who are there with Fitter right now, I mean, what is their opinion on HPV vaccine and the cancer incident? I mean, if they are into only blood kind of pathology so far, it's a different thing. But if
we don't have oncologist in the lab.
No,
so
not,
what we
not
have right now,
oncologists, but pathologists. I mean, they might have been seeing pap smears, or maybe their friends must have been seeing lots of pap smears. So, what do you think that cervical cancer incidence is not as high as being told? And what about the HPV vaccines? I mean, doctors. I mean, just asking if it is.
So I think nobody before I started raising questions was talking about data. I mean, sure, people have been vocal about what these vaccines could do, but nobody was actually presenting. Yeah, I do believe that, and again, I'm presenting data. If they wish to believe me, that's up to them. If they don't wish to believe me, they want to follow their guidelines.
No,
it's
I'm
up
just
to them.
asking what are their opinions. If
no, I haven't spoken to them. I've not spoken to them.
Okay. And they have also not expressed anything like that.
No, I focus on my thing, they focus on their thing, and we don't intervene.
Fair enough.
Yeah. Okay.
Fair enough.
Awesome. All right. So I think this is a good discussion, sir. Thank you so much for being so kind. And
please, no, sir.
Yeah. Thanks, Nikhil. And you're a fighter. A great, inspiring journey. I hope you get better and you have a full remission. Here's hoping that we chat again. You've sent me a list of topics, and we can probably cover more topics, next time. But thank you so much for joining.
Whenever you have time, and you are managing such a huge company, and you have so many roles to play. So as per your schedule, I am always available unless I am not well. Today also, since morning, after having conversation with you, I started having fever. I don't know why was it.
So sorry.
But so I took paracetamol, and my wife was saying maybe postpone the session, but I was like, it has taken a lot of days already, so I want to do the session. So I took paracetamol, and I am here. So unless I'm very
glad.
sick, I can be
so
available
glad.
any day, anytime. There are lots of things I want to discuss. Again,
sure, sir.
I don't want to prove that you are wrong or I am right or any sort of things. But I want people to have another perspective also. And very, very honestly, my following is very less. I'm not very active on social media. There are people who follow me, who listen to me, and who are influenced by my thoughts. But you have also seen hardly 500 followers on Insta. But so I would be happy if through your platform or your channel, we can spread some information.
Sure,
and again, as today, I will present facts. It is up to people. Let them decide whatever is good for them, whatever is not good for them. And I want to talk about nutrition, about lifestyle changes, GLP-1 drugs, and many other things.
Sounds good.
Some criticism of Fitter, of you, definitely.
Sure,
Today you told me that you should not do ad hominem, and I hope I didn't do any of that. Or
no. I think you've been an absolute gentleman. This is. I think this is what a civil discussion is. In fact, I had a very good discussion with somebody who works for a pharma last night. His name is Avi Bitterman, and I think he posted the entire video, and people can go and see that video. It's a lot more technical video. So I'm not sure how many people will actually watch it, but it's a good civil discussion. And historically, this is I love discussing with people in this format where you don't get personal. There's no ad hominem. There's no crosstalk.
I mean that will not benefit anybody.
That does not benefit anybody.
It will be just like an entertainment movie for people. Some will be in your favor, some will be in the favor of other person, and it won't give any results.
Absolutely so.
Now I am also a patient advocate, and it is my responsibility to tell people what is good, and I have never hidden bad things about medical science or doctors, and now it is my responsibility is even higher to speak in favor of patients, not in favor of doctors.
That is incredible.
So I have to be balanced.
Yes.
Where doctors are wrong, I call out on them. Where patients are wrong, I call out on them. So that will be how I will be going on. And if I get opportunity to speak with you and present with you, then yeah, lots of topics.
We love
Two
that,
things
sir.
I want
You know,
to tell you.
we have so many good doctors such as yourself with us. In fact, today morning I got a proposal from someone who said, hey, we've like 100 plus doctors, and none of us, you know, like we are pro prevention, and can we work together? I'm like, yes, of course. In fact, I see Dr. Prashant is also here. He's also working with us. He's a child pediatrician. And, you know, so I'm saying that we have lots of good people. My problem is that, you know, sometimes doctors feel like I'm against them. I'm against the system, which has kind of, maybe that's a topic for some other time, but you've been part of FIDER. And you know that it is never against a person, it is against a system. And if that system is actually benefiting the patients, because at the end of the day...
Your approach recently is definitely not good. I will say that very, like...
I'll take that feedback.
The approach, I mean, informing patients, informing people about shortcomings of medical system or anything is good, and it should be done. But a balanced approach, I'm not saying if you say something bad about doctors, also say something good about doctors. Not like that. But if something is bad and if something has some good, you should talk about both aspects. Even I mean, we can't do GLP-1 discussion today, but even if we talk about GLP-1, yes, they have many possible side effects and lots of other problems with that. But it is not okay, they are entirely bad. There are lots and lots of good reasons for prescribing GLP-1s, and we can discuss that in another session.
Probably another session.
Lots of good scenarios.
Sure.
And even anybody who has seen my social media, or they can go and check. I have written lots of posts and shared lots of things about GLP-1s, where I have presented both sides of it.
Yeah.
And I mean, I know we have exceeded a lot of time, but just a few last closing things.
Sure.
Just last week, 4 or 5 patients asked me about GLP-1. For 2 patients, I totally told them that you are not a good candidate for GLP-1. One of them was literally begging to me, please prescribe me, I'll pay anything you want. I absolutely refused. I don't prescribe GLP-1 even otherwise, but there were 3 patients who were suitable candidates for that, and they have been trying lifestyle changes since 3-4 years. I'm not saying that their lifestyle approach is perfect, but they have been trying, whatever be the details. But now they should reduce weight, and I know lifestyle is important. It is the base, it is the foundation. But to them, I told, okay, yes, you can get, and it will be good for you. Go and consult a proper endocrinologist. I am a general physician. I don't prescribe this. Go to an endocrinologist, discuss with them about all your personal aspects, and then make a decision. But yes, you can get it, and it will be good for you if there is no contraindication particularly. So that is the thing, and okay, we can discuss on that later on. 2 things very important. Just last, recently you posted about this video, this guy,
yeah,
right, for HPV vaccine. So again, one suggestion: before you share anybody's post or thing, you usually do, but this time you didn't. See what are their views overall. So if you check more of his videos, in every second or third video, he is promoting some supplement, which I'm sure you will not also agree. So this was one, I mean,
right. So no,
it is audible. So in one video, he is promoting shilajit based supplements, in some other videos some ivermectin based supplements, and a lot of those things.
Sure.
So he is not a credible person to talk about anything medical. I'm sure you agree with that supplement part, I suppose, right?
Sorry?
I'm sure you agree on that part, that those kinds of supplements are not required and not
I mean,
good.
again, so like I'm not very pro supplement,
At least not
as you know.
to be advised to people or not to be promoted, right?
Yeah, I mean, I don't promote supplements in general. So
Right.
anybody who's promoting supplements, I would not promote supplements.
Right.
Even if there's evidence, I'm very conservative with regards to supplements. Very conservative with regards to medicine. I'm more of a pro lifestyle guy. Yeah.
Yeah. So and even the
But
supplements, like
point taken.
If somebody is promoting good protein supplement,
Again, I don't promote proteins also.
no, I'm saying if somebody is promoting good protein supplement, I'm still like, okay, this has some benefits at least.
Got it.
if
Yeah,
somebody is
I
promoting-
get your point. I get your point. Yes.
Right. So, okay. Anyways, this was a really good discussion, and I hope I have added some good information for benefit of people, and then now it's up to people, whatever they want to choose. Yeah.
Thank you, sir. Have a great day.
Thank you. Thank you. Bye.
Okay, all right, guys. So we had a good discussion, and this is what I was talking about when I said, look, I want to go for a civil debate. I'm not the kind of person who'd go on a debate and then, try to win a debate. I would present the data, and the other person would present the data, and that way, people can learn a lot. And the idea is that the more you empower people to make these decisions for themselves, and the way you empower them is not through authority, but by educating them. Like, for example, when I mentioned here that the numbers needed to harm are much lower compared to the numbers needed to treat. And there's a meta-analysis. You can again go in my story. I posted this meta-analysis. You can see, and remember that this meta-analysis is a pooled analysis of the randomized control trials where they did not measure cervical cancer endpoints. They measured the surrogate markers, which is the SIN1, SIN2, SIN3, right? So when you are looking at the number needed to treat, you are not looking for cervical cancer endpoints. You are primarily looking at SIN1, SIN2, SIN3. And so if you really want to understand the numbers needed to treat, you have to go back to the Swedish registry, where the number needed to treat is roughly 2,200 people, which means that you have to give this vaccine for 2,200 people, and maybe 1% will get saved, 1% will not get cancer, right? So to say that HPV vaccines have a massive benefit, unfortunately, the current data does not support that. And do we have some indication that these vaccines over let's say large population, do these vaccines have the potential to harm people? It turns out the data suggests that yes, they do. More than 50%, 0.49, which is roughly 50% more neurological disorders in the vaccinated group compared to the unvaccinated group, right? So again, I'm not a pro-vaxxer, I'm not an anti-vaxxer, I'm like pro-data, okay? Let's not put any drug, any vaccine, any treatment, anything on a pedestal. Let's analyze each and everything, okay, based on updated information which is coming, based on available data, based on meta-analysis, based on everything that's available, instead of just using blind authority. I hope you guys enjoyed this session, and let's see if we can have more such discussions in the future. Thank you so much, and have a great night.